Here at Sibley Memorial Hospital in Washington, plastic surgeon Dr. Mary Ella Carter sees patients with severe facial injuries. These injuries can be caused by car accidents, dog bites, burns, even gunshots. After stabilizing the patient and treating any blood loss or infections, a doctor will begin planning how to reconstruct a damaged face.
Once the patient is medically stable, we would then proceed to the operating room, and depending on the degree of the injury, we look like, is it a soft tissue issue? Do we need to debride the wound? Do we need to clean the wound? We need to make sure that an infection does not develop. And then if it's a facial fracture, we'll often plate the facial fracture. Plates are when we'll often use certain plates. If someone has an orbital fracture, a fracture of the orbital bone here, we'll use plates to realign the fracture, to put it back together.
These are metal or plastic plates that you put on?
Metal, plastic, and titanium. There's many different plates that are used. Here is we have the zygoma, which is a fairly prominent facial bone. If someone has a fracture of their facial bone, they can have a depression. And what we would do is we would just realign that so it's back in alignment. And sometimes rigid fixation, they do need plates. Other times plates are not necessary.
The face has a dense network of muscles and nerves, and reconstructing it is a difficult and delicate job.
Here we have the facial nerve. If one of these nerves is completely severed here, then the nerve that innervates the muscle will then atrophy. So it's very important, really, when evaluating the patient. I look for them, I check their sensation, I check their function, provided that the swelling isn't too bad, so I can see, did they injure the facial nerve? Because it's very important to appreciate that. If it's a very sharp injury, there's a chance that the nerve can be reapproximated in the operating room. If the nerve has been totally avulsed, or the injury is so significant, they may require cross facial nerve grafting or additional.
You would take nerves from another part of the body?
Yes. Now that is not done acutely. That's more of a process in the months to come. But sometimes we do cross-facial nerve grafting. Sometimes we use a gracilis muscle, which is a muscle in the leg, to reconstruct the face if necessary.
Surgeons can use implants to build up a damaged face. One constant concern is the risk of infection, and patients must often take strong drugs to suppress their immune system, which would otherwise attack the implants as foreign bodies.
If someone has facial atrophy, or that is like one side of their face looks great, the other side has, due to trauma, the muscles have atrophied. They've gotten very thin. They show signs of facial wasting. There's many ways that we help to augment them so they look better. Sometimes we'll use facial implants and different fillers and things of that nature, but sure, there's a risk of infection.
What is an implant?
There's an implant, for instance, it's usually made of silicone. There's all different types of implants, but we will use what are known as malar implants, for instance, to help reconstruct, to do a cheek augmentation. We can use mandibular implants to help augment the chin implants, and those sometimes come into play with facial reconstruction. Again, that's often done down the road when you see, facial asymmetry. I think the biggest challenge is, realistically, can we get the individual looking, as aesthetically pleasing as possible, and so they're happy.
Over the last 10 years, surgeons have begun treating some of the worst cases with partial or even full face transplants, using the faces of suitable donors who have just died.
I think the most prominent one recently, I think it was an electrical burn to the face where all the soft tissues, everything was just distorted. So this gentleman certainly looks much better. I don't think he has vision right now, but that is, again, a huge team of, the surgeons were involved in that case. And that is certainly an area in our field that is growing.
Saudi patients needing facial reconstruction have often come to the United States for treatment, but several young Saudi doctors are now training in plastic surgery here in America and should soon return to help build up the specialty back in the kingdom. Facial reconstruction after serious injury has made great strides in recent decades, to the point where in recent years a few patients with the worst injuries have actually had a whole new face transplanted onto them. For Saudi Good Morning, this is Burton Bolag in Washington.